But today we wanted to give you a different perspective, a first-person perspective. Travis is with us today, and we thank Travis for joining us. He's an emergency room nurse at University Hospital's Portage Medical Center. He is also a COVID-19 survivor. So, Travis, thank you very, very much for joining us, and there you are. Well, good. Travis,
thank you for having me, Governor.
Thank you for joining us. And if you could just kind of tell us a little bit, Travis, about your experience.
My experience, it was quite the event. I initially got sick at the end of March with cough, temperature, stayed home from work, which was our protocol. Within a week, my symptoms had gotten worse to the point where I had a high-grade fever, headache, cough, and my shortness of breath was to the point where I could barely get up, around, and walk. So, getting to that point, I couldn't keep my temperature under control. My wife had checked my oxygen saturation at home, and it was very low for a patient of my age and health. So that's when I decided to go to the ER to get checked out to see what was going on. Once there, of course, they did a great job. They got the chest x-ray, which had showed the signs of COVID on it. The doctor told me that I was going to be admitted just to keep an eye on my oxygen levels. So in my mind, I was thinking it was going to be an observation kind of stay, making sure everything was okay before I could go home. But the next day, things had gotten worse to the point where I could barely breathe. And they took me down to the ICU, and I was intubated for 4 days.
Travis, how long were you in the hospital altogether?
I was in the hospital for 8 days.
That must have been a frightening experience, not being able to get your breath. It's got to be horrible.
It was very frightening, especially since I kind of knew what was going on and what was going to happen. But the staff there was very comforting towards me. I couldn't ask for better staff.
And how you doing now?
Now I feel great. I went back to work last week, and it felt good to be back in the ER with my coworkers.
I bet it did. So you originally started feeling sick how long ago then?
Now it would have been a little over a month ago. About end of March, last weekend of March is the first symptoms I started having.
So this journey from first feeling it till now getting back to work, and you went back to work when? Just
last Tuesday.
Last Tuesday. So that's almost a month experience then.
Yes.
Wow.
It was quite the journey once I got out of the hospital, just to regain my strength and just to do basic things at home. But now I feel back to 100%, and I have to be back at work. Be back at work with my coworkers and just everyone there.
Yeah, no, that's great. Oh, that's great. Did you think you had COVID-19? Did you kind of self-diagnose or?
I didn't want to accept the fact that that's what I thought I had. But in the back of my mind, yes, I probably thought I had it. But being an ER nurse, I'm stubborn and should have probably went sooner to the hospital than I did, but I'm grateful for my wife who pushed me there.
Dr. Acton is also here. You can't see us, but Dr. Acton, do you have any questions?
Hi, good afternoon.
Hi.
Two things kind of strike me that I've been hearing, and since you also work in the ER, you're probably seeing some patients as well. But, you know, people do think, like, it's a hard recovery, I've been hearing from patients. Sometimes it takes a while. And especially for strength to come back. I just talked to a young gentleman in his 20s who very great shape, unlike those of us middle-aged folks, and was saying to me it took him a good month and a half before he could do his regular exercise. Is that something you're feeling, and did you see in other patients?
For me personally, when I got back home, I started kind of doing little things once I got my strength back, and then I started walking a little bit, which really helped, I think. But it does take a very long time to recover from this once you've had it and went home to get back to full strength.
Was there anybody in your life who'd had it? Did you know anybody who had it? Anyone in your family? Okay. And I think that's something too here in Ohio. You know, a lot of us have not caught it yet, but I think a lot of us are wondering, do we know someone in our lives who's had it? So I bet a lot of people were curious to see that you did.
Yeah, no, family-wise and friends, no one that I've known has had it or had it prior to me getting it. So it was quite the experience to go through with my family and my coworkers who were there for me.
And Travis, how did that has to be tough on your family?
Yes.
How'd they get through that? All right, or how did
it was very hard for my family due to the no visitors at the hospital to keep this down. But the hospital brought an iPad into my room each day so we could communicate back and forth to each other. And my work family also reached out to my wife, constantly making sure that she didn't need anything at home. We have a great team at the hospital. I cannot thank the UH leadership and my coworkers enough for their support and care during this difficult time for us.
Great. Sean, you guys?
No, I was curious about that myself, about whether or not, you went through it, but you were able to live in a way where nobody else who was close to you got COVID, and just talk about if there is a little bit more insight on how you were able to prevent the spread in your own situation.
To prevent, for me, it was, when I got sick, I separated myself in the house, would only not really leave the room that much unless I had to. So I was separated from everyone, just trying to keep the chances of them getting it down, which luckily no one did get it in my house. So.
Wow.
Well, you're clearly, these personal experiences, I think, are really important for all of us to hear. I think we're super happy to see that you're back at it, you're recovered, and now you're continuing to be one of those frontline people who are serving others. So we thank you for that service as well.
Travis, thanks so much for sharing with us. We are very, very grateful for you doing that. We had not had anyone here who had gone through it, and we really thought it was important to have someone who lived through it to really talk to the people of Ohio about what that experience was like.
Yes. Thank you for having me.
And thank you to your team, too, on the front lines. We're thinking about all of you. Thank you.
Thanks, Travis. Appreciate it very much.